Well, we're here today with Dr. Kahan, a podiatrist in Carmichael, which is close to Sacramento. Is that correct, Dr. Kahan?
Yes, Mr. Flash, it is.
Yeah, wonderful. Dr. Kahan, you're a podiatrist, and tell us patients a little bit about that. You see, we patients, when we go to a doctor, on one hand, we kind of feel a doctor is a doctor is a doctor, or in your case, a podiatrist. Well, same thing. It's still a doctor. Why? Because you guys have, the licenses, the government, the state, everybody license you. There's only so many schools in the country, and we all come from those schools. So we're well protected. At the same token, we get that distinct feeling that not every podiatrist or doctor is the same, and that we want to match the podiatrist a little bit to our feeling, philosophy, blah, blah, blah. And also we have found that not every podiatrist does all the same procedures. Some concentrate more on this, some more on that. So tell us a little bit about your practice, the type of patients. Like if a mom has a kid and gets sports injury, would she be welcome and well served in your practice? If she wants, the mom herself wants better looking feet because going on the beach, there's some, they don't look so good, the toes. But just tell us a little bit, and if you don't mind, Dr. Kahan, what made you becoming a podiatrist?
It's an interesting question, and I will start with that because obviously I've been asked more than once. Okay. Why did I become a podiatrist? I have to say that when I was about 17 years old, it was the day before the second biggest track meet of my high school career, and guess what? I came down with an ingrown toenail. And there wasn't a podiatrist that was working on the next day, which was Wednesday. We happened to find one doc. I'm going to put in a plug for Dr. Cornfield, of all things, Dr. Cornfield, podiatrist down in Southern California. He fixed my ingrown toenail, and from that day forward, no, I didn't say when I grow up I want to be just like him, but after a couple of years of college where I was looking at veterinary medicine, I thought, you know what, that's not looking it wasn't so appealing anymore. And somehow that podiatrist made a deep impression on me at that time. I looked into the field, thought, very interesting. I was very involved with athletics and sports medicine, and it just kind of fit. And boom, look, here I am. 20 some odd years later, and practicing.
It's great to hear those stories. Because, people who really go in because of some personal experience in almost all businesses, they do great. I mean, even if you look at, Sara Lee Cake or Coors Budweiser or something like that, I mean, those guys just made a couple beers and friends liked it at the 4th of July party, if they had one that time, what do I know? And on it went. Next thing you know, they had to sell it because they couldn't make so. So it's like being thrown into something because you had a personal experience is a wonderful thing. Now, what service can we expect in your practice? Tell us about that.
Interesting. I'm gonna regress really quick on that point where you said, with the impression, that I went in to the podiatrist, he fixed my problem, and literally a couple hours later, I felt like $1 million. I felt just as good as before I had the problem. What's beautiful about our practice, and I think what really led me down the path, was the fact that so many things that we do have a quick resolution. And how many medical fields can say, the patient came in and either 2 hours later or 24 hours later, they felt like they were 100% back to normal, and that to me is a beautiful thing. On to the question, what do we do in this practice, and what can patients expect? I was partially surgically trained, and we did a little bit of surgery early on in my podiatry career. But I slowly realized that, again, so many of our conditions that we treat, whether it's a 3-month-old child with some kind of a foot deformity due to childbirth, or something as simple as an ingrown nail in a newborn, which are very common as well. And we basically teach the parents how to resolve that without traumatizing the kid, which is very easy to do. But so many things that we get involved with can be corrected very conservatively. It may not take a day or two. For example, something like heel pain or plantar fasciitis. It comes on quick. It goes away really slow. But nonetheless, most of our problems are very treatable, resolvable without massive surgical intervention, 90 to 95% of the time. Yeah, huge bunions. There's always a case where a patient comes in and if I tell them, hey, you need surgery, there's really no option, then guess what? They need surgery. But right, most of the conditions we do.
What you're saying, Dr. Kahan, is that you try to go as minimum invasive as possible. You try to let the body repair, do its things. You're not there right away with the scalpel and cut and do things. You believe that somehow we don't have extra parts, you know what I mean? And they need to be cut out. That's needed. However, there are times when it is needed. Great. So give us a small overview of the type of problems, dysfunctions people could come in. Like I mentioned, I sprained my ankle. Let's say I'm an adult like I'm now. My wife says I'm not, but that's beside the point. Or like I'm a little kid. Am I in the right place in your practice? Emergency treatment for the foot angle. Am I in the right place in your practice?
Oh, absolutely. We have extensive training in any foot and ankle conditions. We see simple things such as corns and calluses and complications such as multiple fractures or not necessarily compound fractures, because a compound fracture usually is a medical emergency. You go to the emergency room. Fracture care, which we see quite frequently. We can do closed reduction of a fracture in the office. In other words, a patient comes in and has a broken bone in the foot. If it can be reduced in the office without opening under local anesthetic, we can manipulate that bone back into position. Obviously, that's a little more complicated than something like fungal nails or onychomycosis, as they call, which can be treated a number of ways, simply with medication or with the latest technology that we have available is with laser treatment. And what a phenomenal advance that has been for the field of podiatry and dermatology since we are dealing with a skin type condition. What an incredible addition to our arsenal at this point. Many times you can treat a condition without throwing pills down the hatch, or a patient comes in and 20 minutes later they walk out and there are no ill effects, and 6 to 9 months later, for example, with the nail fungus, they're looking down and thinking, oh my gosh, I never thought this was possible. I can go to the beach again. I can go to the pool, etc. Plantar fasciitis we treat, ankle injuries, sports injuries, work injuries, just a multitude of foot and ankle conditions, again, that can be treated very conservatively with technology that we have available, such as soft tissue lasers, which are great for muscle strains, diabetic painful neuropathy, which is very treatable, which is I'm not going to say controversial, but people really don't realize what the technology that we have at our fingertips now that can resolve and help so many situations. It's podiatry and medicine in general, just like technology in the business world and at your home computer, is advancing at just a very, very rapid pace.
It's wonderful. Well, thanks for letting us know what your practice is all about and what you do, and we're going to talk more about some specific issues. Thank you very much, Dr. Kahan.